Supervisors. Thank you for joining us here today. As many of you know, the county's face covering guidelines went into effect yesterday. I want to applaud everyone who is adhering to this guidance from our public health officials. By now, we know someone may be contagious and transmit COVID-19 without showing any symptoms whatsoever. Wearing a face mask covering helps prevent the spread of droplets from your nose and mouth, and choosing to wear one protects the health of our entire community. The measures safeguard our healthcare workers and first responders, keeping them healthy and preventing our neighbors from getting sick. Across the county, the brave people on the front line are working around the clock to save lives and care for the sickest members of our communities, and I know we are all grateful. They are putting their lives at risk and coping with the added stress of potentially exposing their family members to the virus when they go home after a long day. Today, I'm excited to announce a new partnership with Airbnb to provide much-needed relief to our heroes on the front line. Los Angeles County, in coordination with the City of Los Angeles, is partnering with Airbnb to provide free housing to up to 1,000 frontline workers fighting the spread of COVID-19. This is a generously funded Airbnb, and additionally, LA County workers will have access to free stays through Airbnb and Hotel Tonight, so they can be close to their patients and safely distanced from their families. Community members can get involved by donating funds or getting their property approved for frontline workers to stay. Healthline workers and first responders can book their stay, and community members can learn more by going to airbnb.com/COVID-19 relief. This program is a testament to the value of public and private partners joining together to tackle our biggest challenges. It's really our privilege to protect those who are doing the most important work in our communities each and every day. Now, I would like to recognize Dr. Clayton Kazan, the Chief Medical Officer of Los Angeles County Fire Department, who is spearheading so many of the important efforts underway as well. He is here to share an update on the county's testing efforts, which I know many people have been asking about. Dr. Kazan has worked relentlessly to coordinate all of our testing sites over the last several weeks. Because of his dedication, Los Angeles County now has 30 established sites across the entire region. Soon, LA County will be able to test 1,000 people each day. This is one of the most critical steps needed to help us move toward recovery. With that, I would now like to invite Dr. Barbara Ferrer, Director of the Department of Public Health, to provide daily case counts and latest updates. I want you all to remember we are all in this together, working to prioritize the health of our communities. Thank you.
Good afternoon, everyone. Thank you so much, Supervisor Barger, and to the entire Board of Supervisors. As we address the COVID-19 pandemic, we're grateful for your steadfast and thoughtful leadership. To update you on our current status, I'm sad to report an additional 40 deaths today. 28 of the people who passed away were over the age of 65, and 19 people who died over the age of 65 had underlying health conditions. There were 8 people who died who were between the ages of 41 and 65, and 6 of these people had underlying health conditions. And there was 1 younger person between the ages of 18 and 40 who also had underlying health conditions. We do have 1 death that's still under investigation, and there are 2 cases that were reported by the City of Pasadena for which we do not have information. This brings the total number of deaths to 495 in Los Angeles County, and our mortality rate for COVID-19 is at 4.3%. 87% of the people who have died from COVID-19 had underlying health conditions, reminding us of how important it is that we do everything we can so that those with underlying health issues are able to remain safely in their homes with the rest of us helping to make sure they have all of their essential services and supports delivered to their homes. For the 425 deaths where race and ethnicity has been identified, 16% are African American, 18% are Asian, 34% are Latinx, 29% are white, and 3% of the people who passed away identified with another race or ethnicity. And I want to know that we're working hard with our community partners to respond to the disproportionate number of deaths that we continue to see among African Americans, and also tracking information for other subpopulations where there may be disproportionality in the burden associated with mortality rates. This includes right now addressing immediately issues that are related to the access to testing, to access to health services, and to access to accurate information about COVID-19. For those of you who are grieving lost loved ones, we are really sorry, and please know that you remain in our thoughts and prayers every day. Today, we're also reporting 567 new cases. Over the last 48 hours, there have been 966 new cases in LA County, and our total number of cases for the county is 11,391. These cases include 406 cases reported by our partners in the city of Long Beach and 198 cases reported by the city of Pasadena. We're also reporting a small increase in the number of confirmed cases among people experiencing homelessness. The majority of the people who are confirmed as positive among people experiencing homelessness were unsheltered, but there were 10 people who were sheltered, and they're now appropriately isolated, and their close contacts are quarantined. We are conducting investigations at 7 different shelters and identifying staff and guests that need testing, isolation, and quarantine who are residing at these sites. There are 3,014 people who at some point in time and who are positive for COVID-19 have needed to be hospitalized. This remains around 26% of all of our positive cases. For the 1,624 that are currently hospitalized, 33% of these people are in the ICU, and 20% of these patients are on ventilators. We're also currently investigating 228 institutional settings with at least 1 confirmed case of COVID-19. This is 19 additional investigations since yesterday, and these investigations are happening across nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. The total number of confirmed cases in institutional settings has risen to 2,183, and that includes 1,215 people who are residents in facilities and 968 people who are staff. And I'm sad to report that there are 177 people who are residents in institutional settings that have lost their lives for causes related to COVID-19. These are primarily residents who are residing in skilled nursing homes and assisted living facilities. And this now represents 36% of all of our deaths. So we are extraordinarily worried about the outbreaks that continue to happen across the many different institutional settings. And I do want to note that while in most institutional settings where we're investigating, there's a very small number of cases, there are 20 nursing homes and care facilities that have had outbreaks with more than 20 residents testing positive for COVID-19. And out of these 20, there are 4 sites that are experiencing large outbreaks of more than 40 residents or more. Next week, as I noted a couple of days ago, we're hoping to have a dashboard with information by site that includes the number of positive and suspect cases among residents and staff, and also the number of deaths. We have requested additional assistance from the Centers for Disease Control and the state to help us address the need for increased technical assistance at the large number of sites that have positive cases. This is particularly technical assistance around being able to implement stringent infection control processes. And also, we've requested additional staffing to support the high rate of staff absences at some of the facilities, which again limits the ability of the staff to provide high-quality care. We're also working with a handful of nursing home providers who have offered to help us set up sites that can serve COVID-19 positive patients that need to reside at SNFs, at skilled nursing facilities and intermediate care facilities, and are transitioning back, in many cases, from having stayed in a hospital for a few days. We're also reporting 77 confirmed cases. At some point, these people were positive in our jail facilities. That includes 17 inmates and 60 staff. Currently, the Sheriff's Office is reporting that there are 15 inmates that have tested positive. There are 53 inmates that are in isolation, and 1,401 people who are incarcerated are at this point in time quarantined. There are 67 cases in both our federal and state prisons. That's among that's 11 staff people and 56 inmates. And we remain at only 4 cases in our juvenile facilities, and these were 4 staff people. We do post a list of facilities with confirmed cases on our website once they've had an opportunity to notify their staff, residents, and families. And you can always see every day an updated report of LA County cases on the Department of Public Health's website at publichealth.lacounty.gov. The Los Angeles County Sheriff Department is reporting 38 positive cases among staff. There are 350 staff that are currently quarantined, and 406 staff have returned to work. The LA County Fire Department is reporting 17 positive cases among staff. 12 people are quarantined in their homes. 3 people are home in isolation and sick, and 14 people have returned to work. Thank you again, Sheriff Villanueva and Chief Osby, for tracking and reporting this data. You'll hear more about the expansion of all of our testing capabilities in the county from Dr. Kazan in a moment, but in summary, over 74,000 people have been tested, and their results have been reported to the LA County Public Health Department, and 14% of these folks have tested positive. And I do want to note that we owe a debt of gratitude to Dr. Kazan for elevating our ability here in LA County to test thousands of more people each day. So please join me in being so grateful that we are now living in a county that has expansive testing availability for all of our residents who are symptomatic with respiratory illness. And I want to note that on Monday, Dr. James McKinnell, who works with us at the Department of Public Health, will assume leadership for coordinating testing capacity across the county. He's an infectious disease physician with experience in healthcare systems, epidemiology, and the spread of infections in healthcare facilities. We're grateful that he'll be able to work with Dr. Kazan as we make sure that we continue to have testing capacity available for all residents in LA County who need to be tested under the guidance of their provider. I have a couple of new updates today that I wanted to share. The first is we've figured out an ability to report to you periodically around pregnant women who are positive for COVID-19. I know there's been a lot of interest in outcomes for women who are pregnant. We do have a little bit of data. We've identified 61 women in the county who are pregnant and who tested positive for COVID-19. 10% of these women are in their first trimester of pregnancy, 33% are in their second trimester, and 34% are in their third trimester. But there are 12 women who were positive with COVID-19 who did already deliver their babies, and all of their babies were delivered safely. So we welcome your new babies to LA County. 6 of the infants who were tested all tested negative. And we wish you and your families well as you begin your new journey with your new babies. I also have an update on cases amongst healthcare workers. Just a reminder, we'll be reporting on these updates for healthcare workers that are infected with COVID-19 once a week. We're reporting an additional 654 confirmed cases among healthcare workers who tested positive for COVID-19. And that brings our total number of healthcare workers who are positive with COVID-19 to 1,441 people. 38% of the cases are among nurses, 6% are among physicians, and 4% are among administration, and an additional 4% are among non-patient facing services at various healthcare facilities. The rest of the cases are scattered amongst many different healthcare occupations. The cases come from 26 different settings across LA County. Hospitals continue to represent the majority of sites where healthcare workers are testing positive. That number is at 36%. But the number at skilled nursing facilities has increased from 19% last week to 31% of our total number of cases this week. 9% of staff who are working in healthcare facilities that tested positive work at outpatient sites, and the remaining staff are again across a variety of other settings. Half of the healthcare workers are reporting a known exposure to COVID-19, with 36% of them noting that the exposure was either another healthcare worker and or a patient. 8% of healthcare workers who have reported a positive test for COVID-19 have at some point been hospitalized. And I'm also saddened to report that there were 5 deaths among healthcare workers who tested positive for COVID-19, and all have been fairly recent. Three people worked in skilled nursing facilities, 1 person worked in correctional health, and 1 person who passed away worked in the hospital. 3 of the 5 people who died were nurses. And to the families of the healthcare workers who lost their lives, we're very sorry for your loss, and we keep you in our prayers. These workers, all of them, all of our healthcare workers, help all of us when we're sick, and they are our heroes. And we can't thank our healthcare workers and frontline workers enough for all they are doing. We've been talking a lot this week about moving forward and being able at some point in the near future to lift some of the safer at home restrictions. COVID-19, as you note from all the numbers I report, has spread across our entire community. So we need to continue to do all we can do to slow the spread and prevent as many infections as possible while we plan for our recovery. And just as a reminder, Safer at Home is still in place, and it's important that everyone continue to follow the directives that are contained within the health officer order. This means staying home as much as possible, and if you must be out for essential services, as a reminder, you're required to wear a clean cloth face covering and maintain your physical distance of 6 feet or more from other people that you may be in close contact with. Cloth face coverings should be worn anytime you're accessing essential services and that you're around people who are not members of your household. This means wearing your cloth face covering when you go food shopping or into a pharmacy. It also means wearing your cloth face covering when you drop off or pick up your child from childcare and when you pick up food from a restaurant. Wear a cloth face covering if you're using the metro, a public bus, a rideshare service, or a taxi. If you're coming close to anyone that's not in your household, a member of your household, please remember to put on your clean cloth face covering. This helps you to not spread the virus to others, and it does protect our essential workers. And I do want to give a big thank you to all of our many, many essential workers. You're working under extraordinary circumstances, and you're keeping things running for the rest of us. We are very grateful, and we pledge to protect you when we come into the places and spaces you're working. If you've tested positive for COVID-19, a reminder as we go into the weekend, or you have symptoms of respiratory illness and you're waiting for your test results, or you've been told by your provider that you're likely to be positive, please self-isolate for 7 days and 72 hours after symptoms and fever subside. Please also tell all of your close contacts that you are positive for COVID-19. And if you've been a close contact of a person who is positive for COVID-19, please make sure you're self-quarantining for 14 days. Each day, I'm inspired by all of you who are continuing to do your part to slow the spread of COVID-19. In this challenging time, so many of you have shown courage, goodwill, and compassion as all of our lives have changed, and we've all been affected in very different ways. These times are tough, but I know that they're temporary, and we're in this together, as Supervisor Barger mentioned, and by working together, we're making it possible to get to the other side. Thank you all so much. And now it's my pleasure to introduce Dr. Kazan, the Medical Director of LA County Fire.
Thank you very much, Dr. Ferrer, and good afternoon, everybody. I'd like to start by expressing my heartfelt thanks for the gratitude that the public has shown to our first responders and our healthcare workers. We deeply appreciate it, and we're proud to be here every day to serve you. On that note, on behalf of the Los Angeles County Fire Department, I would like to extend our thoughts and prayers to the Torrance Fire Department engineer and his family as he battles this disease. The best way that the public can help is to donate blood or plasma, and to determine if you're eligible and find a donation center, please go to redcross.org. We're facing a very severe shortage of blood for our patients right now. On March 18th, the Board of Supervisors requested my assistance with the scaling up of COVID-19 testing across Los Angeles County. At the time, there were only a few labs capable of doing the PCR testing here, and most specimens were sent out of state. Doctors couldn't order the tests, and patients had very little access. Over the ensuing weeks, we built an enormous coalition with the county's Unified Coordination Group, with our partners at the city, Mayor Garcetti, the City Council, and my colleague at the city, Dr. Mark Eckstein, with our board offices and local political teams, with our fire department incident management team, and with healthcare stakeholders from all across the region. In less than a month, I'm very proud to share that we've built a network of 30 mobile testing centers with a total capacity of about 11,000 tests per day. Virtually all of the labs that we do are processed in the Los Angeles area. It's not a perfect system. I understand that there are some concerns around the turnaround time, and it has been a little bit bumpy for a start. But we're getting better every day, and we ask you to please bear with us as our labs in particular get caught up and really get their stride. The testing capacity that we've been able to bring to Los Angeles County rivals the capacity of virtually any country in the world. While we knew that we would not be able to put a center on every corner or in every city, we have achieved the point where testing is accessible to the vast majority of our communities. We now have available appointments, often same day, across our testing sites. We encourage symptomatic people and doctors who are trying to order these tests for their patients to take advantage of this opportunity. You can find out if you qualify and register for testing by visiting our website at covid19.lacounty.gov. Now that the system has been constructed, we'll begin transferring the COVID testing branch from my team to the Department of Public Health. And as Dr. Ferrer mentioned, I'll be passing the reins to the very capable hands of Dr. James McKinnell, who's an infectious disease specialist. He and I have been working together over the past week, and I will be here to support him for as long as is necessary to ensure a smooth and successful transition. As glad as I am to be returning to my own area of expertise in EMS at the fire department, I want to express my immense pride and gratitude for the opportunity to play a part in such a monumental achievement for the residents of Los Angeles County. And at this point, I'm going to introduce Dr. Christina Gali from the Department of Health Services. Thank you.
Hi, and good afternoon. I'm Dr. Christina Gali, the Director of the Department of Health Services. I'll give a brief update today on a couple of topics, testing particularly for employees and healthcare workers within the department, as well as a brief synopsis of the bed count. Let me start just by thanking all of the healthcare workers and first responders out there. I hope that these sentiments, when they're relayed to you and when you walk around your neighborhoods and you see the signs that are posted in people's windows and yards, that you realize how much our hearts and our thoughts and our prayers are with you, and we're so grateful for the ongoing work that you're doing. It takes the teams of individuals that are out there to save the lives, and we're grateful for all you're doing. Access to testing is a critical part of the COVID-19 response, and I'm grateful to the leadership of Dr. Kazan over the past several weeks, as well as to the new leadership of Dr. McKinnell as he takes on this great task. In a time of crisis like this, we do want to make sure that we're doing everything we can, not just for testing of patients, but also for testing of our healthcare workforce, who may be exposed to COVID-19 in a variety of settings, both within the community as well as in their workplace. All Department of Health Services employees who have symptoms of COVID-19 can be tested through Employee Health Services as part of the department. This option is available to any employee or contracted workforce member who has symptoms and would like to be tested. Of course, individuals can also receive testing through their own personal provider or through one of a number of drive-through testing sites that Dr. Kazan had a hand in setting up. As is the nature of the virus, it's complex, and we want to make sure that people have multiple opportunities to be able to receive testing, though we realize that the exposures are varied and many. Workplace exposures can be reduced through careful use of personal protective equipment, as well as by following all infection prevention and control guidelines, things like using masks and careful hand hygiene. And I can't underscore the importance of continued hand washing as the first line of defense in preventing exposure to COVID-19. And that applies for the general public as well as to healthcare workforce. Staff across the Department of Health Services have access to personal protective equipment, including masks, in sufficient number to protect them, and we follow all public health guidelines, including those put out by our own public health department, as well as the state and the Centers for Disease Control. I'll also give just a brief snapshot on the bed count that's available across the county. Today, as of this morning, across all Los Angeles County 911 receiving hospitals, there are a total of 1,550 staffed and available beds. This includes 242 intensive care unit beds. There are an additional approximately 900 staffed licensed beds that are in other non-adult or specialized care settings. This includes pediatric units, labor and delivery units, trauma units, burn units, other types of beds that can also be used for COVID-19 patients as needed in a surge. There's also additional hospital capacity that is available and being added on in hospital surge plans over and above their typical staffed license capacity, as well as the capacity that's been brought online through resources such as the Mercy Ship and the LA Surge Hospital, or the LASH. Among the 4 DHS hospitals, we currently have a total of 501 available staffed beds, and this includes 73 ICU beds. Our ED volume continues to be much lower than normal, running at about 50 to 60% of normal capacity. In the last 24 hours, there were 458 emergency department patients through our 3 emergency departments. We would encourage all those individuals who are experiencing a medical emergency to please call 911 or transport themselves to their nearest local emergency department so that they can receive care for whatever is their ongoing or new issue. I do want to emphasize that all of the efforts are very difficult on everybody. I know that the toll that this is taking on people's personal and professional lives, and I'm grateful for everything that the community and the workforce, the county workforce, city workforce, state workforce, and all of the individuals working across the public and private sector are doing to come together and help develop a coherent and strategic and coordinated response to COVID-19. By working together and by banding together in these difficult times, we can make tremendous progress, and I'm so thankful for everything people have done. With that, I'll close things out and turn it over to Ryan for questions.
Okay, ladies and gentlemen, if you do wish to ask a question, please press 1, then 0. Our first question is going to come from the line of Sherry Mossberg with CNN. Please go ahead.
Good afternoon. This question is for Dr. Ferrer. I'm looking to see if you can tell me a little bit more about the mortality rate and put that in context. I see it more than doubled in the last 2 weeks, And what can you attribute that to? Is that lag time or what exactly?
I think, and thanks a lot for your question, I think a lot of it is a lag time issue. As we have more cases, we're going to see more people dying. That's the unfortunate and devastating reality of COVID-19. But it's not a day-by-day match. So the days that you see more cases, you don't necessarily have the same proportion of people that might die that day as you've seen an increase in cases, because oftentimes people are ill for a few days before they pass away. So I think that's one issue. I think the second issue that's contributing to the increase in the death rates is, as I've noted, we have many more skilled nursing facilities that have seen a significant number of cases within those facilities. And the people who are residents in those facilities are often already in fragile medical condition. And a disease like COVID-19 both spreads more easily in a congregate living situation and also can have devastating impacts on people with underlying health conditions. You know, somewhere between 85 and 87 or 88% of all of the people who have died in LA County from COVID-19 have had an underlying serious health condition. And I think our most vulnerable are obviously many of the residents who are staying in skilled nursing facilities, intermediate care facilities, and other congregate sites where it's easy for both the site and the people who are staying there, as well as the employees, to be overwhelmed with the quick spread of an infection. But thank you for your question. We'll take the next question.
And that comes from the line of Louisa Marshall with NBC4. Please go ahead. Your line is open.
Hi, thanks so much for taking my question. I appreciate it. My question is also for Dr. Ferrer. There's recent research, including an article published from a top researcher at MIT, saying that aerosols containing COVID-19 released by coughing or sneezing can travel up to 28 feet in distance. In light of that research, should 6 feet physical distancing be the recommendation?
No, I'm thrilled that there are so many scientists and researchers that are giving us a much deeper understanding of the virus. I just would caution all of us that oftentimes what gets studied in sort of a lab setting and how this virus actually acts in the real world may be slightly different, and that it's often helpful to have multiple studies that are exploring similar issues so that we can actually benefit from what I call the collective wisdom of the researchers and scientists. So we are paying attention. You know, to date, I think, as with many coronaviruses, the 6 foot distance is a practical distance. It's a distance that we know respiratory droplets are easily able to be transmitted. But as you note, our guidance is just that, and it really says, you know, stay as far apart as possible. The minimum distance should be 6 feet. I think as we find out more information, we're going to do a really good job being able to be more precise around the guidance. But I do think we need more studies that really look at how this virus is interacting with all of us in the real world. But thank you for that question. And we'll take the next question.
That will come from the line of Dakota Smith with LA Times. Go ahead. Your line is open.
Good afternoon. I have some questions about the new county-backed Los Angeles Surge Hospital. As you know, this facility opened on Monday at the site of the St. Vincent Medical Center. Can you tell me, and this question is for whoever is most qualified to talk about the hospital, how many patients are currently there? And if you visited the facility, could you give us a sense of what you saw and what it's like there? And what role do you see this hospital serving in the crisis?
Yeah, hi, this is Christina Galley. I'll take that question. The current census in the LASH facility is 8. That was as of this morning. They intentionally opened on what we just referred to as a slow ramp up to get the hospital and its staff adjusted to accepting patients. They wanted a mix of ICU patients and medical, surgical, general acute care patients. And their efforts are ongoing to be able to increase the volume of transfers to the LASH in the coming days. One of the things that is being discussed is what you're alluding to, which is what's the best use of that facility, given the ongoing changes in the demographics and the epidemiology, and as well as what hospitals, the general acute care hospitals across the county are experiencing. The hospital is intended by the state and the county to be a resource for the general acute care hospitals, and everybody is actively looking at making sure that whatever changes need to be made in the patient transfer process allow for accommodation of that. The team on the ground is excellent. They've done a fantastic job with the partnership with Dignity Health and Kaiser Permanente on setting it up, and I would encourage people to reach out to them directly to get the on-the-ground experience. We'll take the next question.
And that will come from the line of Lee Ross with Fox News. Go ahead, your line is open.
Thank you so much. This is a question for Dr. Ferrer. Yesterday, you noted that the results of the county serology study would be announced early next week, though it sounds like maybe you already know some of the results. With that in mind, I'd like to get your thoughts on today's Stanford antibody test results for Santa Clara County, which showed an infection rate of up to 85 times the number of people who've actually tested positive, for an infection fatality rate of 0.12% to 0.20%. What do you make of these other numbers published today, and how might they compare to LA County's numbers to come next week?
Yeah, and thanks so much for that question. And we will actually make sure that we're able to release the results from the serology testing on Monday. So our team is hard at work with the researchers from USC, our partner, making sure that we can provide a complete report out on Monday. But we anticipate that our results, while the numbers are going to be somewhat different, they're going to tell a similar story. And I think the story is what you just said. Many more people have been infected with COVID-19 than those are being captured through our testing and identification of people who are testing positive for COVID-19. That's a reflection, I think, of two issues that we faced across the country. One is the slow start for testing, and one is the fact that for many people, they may exhibit either no symptoms or mild symptoms, and they're not going ahead and getting tested. They may not even be seeking any medical care. But it's an important number for us to have, for us to understand what % of the population here in LA County, similar to the population in Santa Clara County, has in fact at some point come in contact with this virus and developed an antibody response. It doesn't necessarily tell us whether or not those folks are in fact protected, certainly protected permanently from reinfection, and it doesn't tell us what number of people at this moment in time are actually infected with COVID-19, but it helps us understand spread. And as you noted, the biggest implication that it will have for us is it will give us a much better understanding of a truer rate of mortality. If, for example, you think there's 200,000 people that have been infected with COVID-19 and we're reporting 500 deaths, and you then do the math on that, our rate of mortality drops significantly from the 4.2 or 4.4% that we've been reporting this week to a much smaller number. So we're anxious to complete our analysis, and we're anxious to be able to talk with all of you about it, and I can promise you that will happen on Monday. So thanks for that question. We have time for one more question.
That question will come from the line of Ryan Carter, Los Angeles Daily News. Go ahead, your line is open.
Thank you very much. Thank you to all of you for these. I was curious of Dr. Kazan, what the biggest challenge has been in making this test network happen. You mentioned the bumpy roads. And also just as an addendum to that, kind of what the nature of the change in leadership in building up that network will be, where that's going to go under the new doctor coming in on Monday. And just if I may, just one other quick one. We've got an election coming up, a special election coming up in northern LA County on May 12th. And to my knowledge, there's going to be vote centers set up in that election. I think 9 of them all told, 11 days up to May 12th. And I just wondered of Dr. Ferrer, given the stay-at-home extension until May 15th, if you had any concerns about that, but people, congregating in a voting polling station, and what safeguards maybe you've been working through with the registrar's office to ensure public safety in those elections. So thank you again.
Okay, so I'll address the first couple of questions. The first questions were around the biggest challenges in scaling up the system. Anytime that you have to reach out and try and make a lot of connections in a short period of time, you spend a lot of time on the phone, a lot of time sending emails back and forth, and gathering all those people together from all across Los Angeles County was a huge challenge. On top of that, we came into a laboratory system where there was very little capacity, particularly in Los Angeles, and we took the tack that we would prefer to work locally rather than to compete for space in the large national labs like Quest and LabCorp, because we were afraid that we would end up having to compete with New York and New Orleans and other areas that were struggling. So we had to look really hard to find local capacity, and that capacity has been scaling up very rapidly. And some of the challenges that we've had in terms of the smoothness of our ability to get results in a short period of time and things like that have been because these labs scaled up so fast, they're doing their very best to find their stride. But I think now we've actually tapped into a really great resource. Los Angeles County and Orange County together have more complex molecular testing labs than many countries in the world, and we now have connections with, I believe, 5 different labs. In terms of the nature of transferring leadership, it's been my belief for the past month that at some point after we scale this system up that it really should live under public health and be a branch of Dr. Ferrer's efforts, that my purpose and role in this was to come together and assist them with scaling it up and really trying to work what connections I have, since we serve in LA County Fire 58 of the 88 cities in the county. But I always believed that once we had the system scaled up, that it really should live as a strategy of our entire public health focus on COVID-19. So I've always felt that there would be a natural transition. Having worked with the physician coming in, he is a natural fit. Dr. McKinnell is an expert in infectious disease. He has a lot of experience working with the labs, and he has jumped in with both feet. So I think that he sees this eventually transitioning from the idea of a mobile testing site in a parking lot or a shopping mall and really trying to transition this back into that physician-patient relationship and having that be a part of the whole health visit rather than a drive-through testing site where testing is existing kind of as a separate silo of the healthcare system. So I hope that answers your questions, and I'm going to pass to Dr. Ferrer.
I want to, before I answer the question, I do want to, really thank Dr. Kazan, and we owe him a debt of gratitude. I mean, he took us from having only a couple hundred people being tested a day to really capacity to test over 10,000 people a day. And it's just because he worked night and day to make sure that he could partner with others and make this happen. So we all owe him a debt of gratitude. I do want to talk about the special election. It is absolutely appropriate that people be allowed to vote. Voting will happen in as safe a manner as possible. You know, we do encourage people to make sure that you are using your hand sanitizer and that you're wearing your face coverings and that you pay particular attention to keeping your distance physically when you're at any of the voting sites. I do want to also commend all of the folks who have been working to make sure that our elections can happen and happen safely and securely. And that includes that people have had a lot of opportunities to use their mail-in ballots for the special elections. But yes, we've been working really closely with the Election Commission to make sure that, in fact, they have the best infection control protocols available at all of the sites, and people should exercise their right to vote. I will now go to remarks in Spanish. And I'd like to introduce Jackie Valenzuela, who will lead this off.
Buenas tardes. Gracias a la supervisora Barger y a toda la Junta de Supervisores. A medida que abordamos la pandemia de COVID-19, continúa demostrando un liderazgo fuerte y reflexivo. Para actualizarlos sobre nuestros números hoy, estamos tristes de reportar 40 muertes adicionales. 28 de estas personas son mayores de 65 años y 19 personas mayores de 65 años que fallecieron padecían de condiciones delicadas de salud. 8 personas tienen entre 41 y 65 años y 6 de estas personas padecen de condiciones delicadas de salud. Una persona tenía entre 18 y 40 años y tenía problemas de salud subyacentes. Una de estas muertes todavía está bajo investigación. No tenemos esta información para 2 casos, ya que están siendo reportados por la ciudad de Pasadena. Esto eleva el número total de muertes a 495 en el condado de Los Ángeles y nuestra tasa de mortalidad para COVID-19 es de 4.3%. El 87% de las personas que murieron a causa de COVID-19 tenían condiciones de salud subyacentes, lo que subraya la necesidad de que hagamos todo lo posible para que las personas con enfermedades delicadas de salud puedan permanecer seguras en sus hogares. Para las 425 muertes en las que se ha identificado la raza etnia, el 16% son afroamericanos, el 18% son asiáticas, el 34% son latinas, el 29% son blancas, el 3% se identifica con otra raza etnia. Para aquellos que están afligidos por el fallecimiento de sus seres queridos, lo sentimos mucho. Ustedes están en nuestros pensamientos y nuestras oraciones. Hoy también estamos reportando 567 casos nuevos. En las últimas 48 horas han habido 966 casos nuevos. Hay un total de 11,391 casos en el condado de Los Ángeles. Estos casos incluyen 406 casos reportados por nuestros socios en la ciudad de Long Beach y 198 casos reportados por la ciudad de Pasadena, que tienen departamentos de salud independientes. Estamos reportando 39 casos confirmados entre personas sin hogar. La mayoría no tenía refugio. 10 de los refugiados fueron aislados adecuadamente y los contactos cercanos están en cuarentena. Estamos llevando a cabo investigaciones en 7 refugios diferentes e identificando personal e invitados que necesitan pruebas, aislamiento y cuarentena. 3,014 casos han sido en algún momento hospitalizados, el 26% de todos los casos positivos. 1,624 están hospitalizados actualmente, el 33% de estas personas están en la unidad de cuidados intensivos y el 20% están en ventiladores. Actualmente estamos investigando 228 entornos institucionales con al menos un caso confirmado de COVID-19. 19 investigaciones adicionales desde ayer. Estos incluyen hogares de ancianos, instalaciones de vivienda asistida, refugios, centros de tratamiento, viviendas de apoyo e instalaciones correccionales. El total de casos confirmados en entornos institucionales es de 2,183, incluidos tanto el personal como los residentes. 1,215 de estos casos confirmados son residentes y 968 son empleados. Nos entristece informarles que 177 residentes han fallecido a causa de COVID-19 en estos entornos. Esto incluye instalaciones de enfermería especializada y vivienda asistida. Estos ahora representan el 36% de todas las muertes. Estamos reportando 20 hogares de ancianos calificados y centros de vida asistida con brotes de más de 20 residentes que son positivos para COVID-19. Hay 4 sitios que están experimentando grandes brotes de 40 residentes o más. La próxima semana esperamos tener un tablero con información por sitio que incluya el número de casos positivos y sospechosos entre los residentes y el personal, y el número de muertes. Solicitamos asistencia del CDC y del Estado para abordar la necesidad de una mayor asistencia técnica en los sitios en torno al control de infecciones y la necesidad de apoyo de personal para abordar la alta tasa de casos. También estamos trabajando con proveedores de hogares de ancianos para aumentar los sitios que pueden atender a pacientes con COVID-19 que son positivos, que necesitan residir en instalaciones de enfermería especializada y en centros de atención intermedia. Estamos reportando 77 casos confirmados en algún momento en las instalaciones de la cárcel, 17 reclusos y 60 empleados. La oficina del alguacil está informando para sus instalaciones 15 reclusos actuales que han dado positivo, 53 en aislamiento y 1,401 están en cuarentena. 67 casos en las prisiones estatales y federales y 4 casos en instalaciones juveniles, todo entre el personal. Publicamos una lista de instalaciones con casos confirmados en nuestro sitio web una vez que han notificado a todo su personal, residentes y familias. Y puede ver el informe actualizado de todos los casos del Condado de Los Ángeles en el sitio web del Departamento de Salud Pública en publichealth.lacounty.gov. El Departamento del Alguacil del Condado de Los Ángeles está reportando 38 casos positivos entre el personal, 350 empleados están en cuarentena y 406 empleados han regresado al trabajo. El Departamento de Bomberos del Condado de Los Ángeles informa 17 casos positivos entre el personal, 12 aislados en el hogar, 3 enfermos en el hogar y 14 que han regresado al trabajo. Gracias al alguacil Villanueva y al jefe de bomberos Osby por registrar e informar estos datos. Más de 74,000 personas han sido evaluadas y se han reportado resueltos en el condado de Los Ángeles. El 14% fueron positivas. Esperamos escuchar más sobre la capacidad. Ya escuchamos un poco de la capacidad de prueba del Dr. Kazan. También quiero señalar que aparte del lunes, el Dr. James McKinnell del Departamento de Salud Pública asumirá el liderazgo para coordinar la capacidad de evaluación en todo el condado. Es un médico especialista en enfermedades infecciosas y con experiencia en epidemiología del sistema de salud y cómo se propagan las infecciones en lugares de atención médica. Hoy nos gustaría compartir con ustedes algunos datos sobre mujeres embarazadas y COVID-19. Hasta la fecha, hemos identificado 61 mujeres que están embarazadas y han dado pruebas positivas por COVID-19. 10% de estas mujeres están en su primer trimestre, 33% en su segundo trimestre y 34% en su tercer trimestre. 12 mujeres con COVID-19 ya tuvieron un parto vivo. Para los 6 bebés para los que tenemos información de prueba, todos fueron negativos. También tengo una actualización sobre casos entre trabajadores de salud. Estamos informando que 654 trabajadores de atención médica confirmados adicionales han dado positivo por COVID-19, lo que eleva el total a 1,441. El 38% de los casos corresponden a enfermeras, el 6% a médicos, el 4% a administradores y 4% a servicios que son de pacientes. El resto de los casos se encuentran entre varias ocupaciones de atención médica diferentes. Estos casos provienen de 26 entornos diferentes en todo el condado de Los Ángeles. Los hospitales continúan representando la mayoría de los sitios donde los trabajadores de salud están dando positivo, 36%. Pero el personal de enfermería especializada ha aumentado del 19% al 31% esta semana. El 9% son de centros ambulatorios y los casos restantes corresponden a otros entornos. La mitad de los trabajadores de la salud tenían exposición conocida al COVID-19 y el 36% fueron expuestos por otro trabajador de salud y o un paciente. 8% han sido hospitalizados. Estamos tristes de reportar la muerte de 5 trabajadores de salud y todos han sido recientes. 3 trabajaron en centros de enfermería especializada, 1 trabajó en salud correccional y 1 trabajó en un hospital. 3 de los 5 eran enfermeras. Y a las familias de los trabajadores de la salud lamentamos mucho su pérdida. Estos trabajadores ayudan valientemente a otras personas que están enfermas y son héroes. No podemos agradecerles con palabras todo lo que han hecho por nosotros. Hemos estado hablando mucho sobre avanzar hacia el levantamiento de algunas de las restricciones más seguras en el hogar. COVID-19 se ha extendido por nuestra comunidad y debemos continuar haciendo todo lo posible para frenar esta propagación y prevenir la mayor cantidad de infecciones posibles. Más seguro en el hogar todavía está en su lugar y es importante que todos sigamos el orden. Continuar en casa tanto como sea posible. Si debe estar fuera de los servicios esenciales, use una cubierta de tela para la cara que esté limpia y manténgase a una distancia física de 6 pies o más de todas las demás personas. Las cubiertas de tela para la cara deben usarse cada vez que acceda a servicios esenciales y esté cerca de cualquier persona que no sea de su hogar. Esto significa usarlo cuando vaya a comprar alimentos o vaya a una farmacia. También significa usarlo cuando deja o recoge a su hijo de la guardería y cuando recoge comida de un restaurante. Use una cubierta de tela para la cara si usa el metro, un autobús público, un servicio de transporte compartido o un taxi. Si se está acercando a alguien que no sea de su hogar, use una cubierta de tela limpia para la cara. Esto ayuda a prevenir la propagación del virus en los lugares de trabajo y protege a nuestros trabajadores esenciales. Y solo quiero agradecer enormemente a nuestros muchos trabajadores esenciales. Ustedes están trabajando en circunstancias extraordinarias y están haciendo todo que funcione para nosotros. Estamos muy agradecidos. Si ha dado positivo por COVID-19, tiene síntomas y está esperando los resultados de su prueba, o un proveedor le ha dicho que probablemente sea positivo, por favor, aísle por 7 días y 72 horas después de que los síntomas y la fiebre hayan desaparecido. Informe también a todos sus contactos cercanos que es positivo para COVID-19. Y si está siendo en contacto cercano con alguien con COVID-19, manténganse en cuarentena durante 14 días. Cada día nos sentimos inspirados por todos ustedes, ya que continúan haciendo su parte para frenar la propagación de COVID-19. Es un momento sin precedentes y muchos han demostrado coraje, buena voluntad y compasión, a pesar de que nuestras vidas han cambiado drásticamente y todos hemos sido impactados de diferentes maneras. Estos tiempos son difíciles, pero a la vez son temporales. Estamos juntos en estos y al trabajar juntos estamos haciendo posible llegar al otro lado de esto. Muchas gracias a todos. Okay, and now we are ready for questions.
Our question will come from the line of Salvador Doran with Univision Network. Your line is open. Please go ahead.
Hola, sí, buenas tardes. Sí, mire, mi pregunta es la siguiente. Bueno, tengo un par de preguntas. La primera es si ustedes tienen un récord de personas que han fallecido, pero que nunca les hicieron la prueba del COVID-19, pero que posteriormente a su muerte se han enterado que, en efecto, murió por COVID-19. Y la segunda pregunta es en relación a cuánto tiempo el virus permanece en un cadáver. Y finalmente, si puede, por favor, dar una recomendación a las personas asmáticas, ya que pues esa es una de las condiciones que puede complicar a un paciente que esté infectado con el virus.
Buenas tardes, Salvador. Muchas gracias. Lamentablemente, la doctora Ferrer tuvo que dejar el edificio. Así es de que tomamos sus 3 preguntas, ya tenemos su correo electrónico, le vamos a mandar la información por correo electrónico lo antes posible y lamentablemente las recomendaciones que me está pidiendo tampoco se las puedo dar, yo no soy doctor, pero sí le vamos a hacer llegar todas sus preguntas a la doctora Ferrer. ¿Ok? Muchas gracias. And now we'll be transitioning to our remarks in Armenian. Thank you.
Բարի երեկո։ Ուզենք թարմացնել LA շրջանի ընթացիկ ղարքավիճակի վերաբերյալ։ Մենք այսօր ցավով կհայտնենք, որ 40 քաղաքացիներ ևս մահացած են LA գավառի տարածքին, որոնց մեջ 28-ը 65 տարեկանից բարձր էին, իսկ անոնց մեջ 19-ը հիմքուն ունեին այլ առողջական վիճակ։ Իսկ 8 նրանից 41-ն 65 տարեկանի մեջ էին, իսկ անոնց մեջ 6-ը հիմքում ունեին այլ առողջական վիճակ։ Մեկը նրանից 18-ն 40 տարիքի մեջ էր, որ հիմքում ուներ այլ առողջական վիճակ։ Իսկ վերջին մեկը հետաքննության մեջ է։ Դեղեցություն մենք չունենք մյուս երկուքը, որ հայտնում են Փասադինա քաղաքում։ Սա հանգեցնում է մահացությունների ընդհանուր թիվը 495-ի Լոս Անջելոս համայնքում, և մեր մահացության մակարդակը COVID-19-ի համար կազմում է 4.3 առ 100։ COVID-19-ով ով մահացած անցած 87 առ 100-ը ուներ առողջության հիմքում ընկած պայմաններ, ընդգծելով, որ մեզ անհրաժեշտ է անել հնարավոր ամեն ինչ, որպեսզի հնարավոր լինի նրանց, ովքեր հիվանդության հիմքում ընկած են իրենց տներում ապահով մնալու համար։ Եվ ամեն օր, երբ մենք հայտնում ենք այս թվերը, մենք գիտենք, որ կան ընտանիքներ և ընկերներ, ովքեր սգում են իրենց սիրած մեկի գորուստը, դուք մեր մտքերի և աղոթքների մեջ եք։ Այսօր մենք հայտնում ենք նաև 567 նոր բարակաների մասին։ Վերջին 28 ժամվա ընթացքում արձանագրված է 966 նոր բարականեր։ Ընդհանուր առմամբ LA County-ում կա 11991 բարականեր։ Այս բարակաները ներառում են Long Beach քաղաքում մեր գործընկերների կողմից արձանագրված 406 բարականեր և Փասադինա քաղաքի կողմից արձանագրված 1998 բարականեր, որոնք ունեն անկախ առողջապահական բաժանմունքներ։ Հիվանդանոց խնամքի տվյալները, ուրեմն 3014 բարականեր հիվանդանոցի խնամք ստացել են, որ կկազմի բոլոր դրական դեպքերի 26 առ 100-ը։ Ներկայումս 1624-ը հիվանդանոցի խնամք ստանում են, այս մարդկանց 33 առ 100-ը գտնվում է ICU intensive խնամքում, իսկ 20 առ 100-ը օտափոխիչների վրա։ Քննության արդյունքներ։ LA County-ում ավելի քան 74,000 մարդ քննված և ստացել են արդյունքների մասին լուրը, որոնց 14 առ 100-ը դրական է։ Ես նաև ուզում եմ նշել, որ երկուշաբթի օրվանից DPH-ում Dr. James McKinnell ստացնում է ղեկավարությունը շրջանի թեստային կարողությունները համակարգելու համար։ Նա վարակիչ հիվանդության բժիշկ է, առողջապահական համակարգերի համաճարակաբանության փորձով և ինչպես վարակներն են տարածվում առողջապահության ոլորտում։ Հղի կանայք և COVID-19։ Այսօր մենք ուզում ենք ձեզ հետ կիսել հղի կանանց և COVID-19-ի վերաբերյալ որոշ տվյալներ։ Մինչ օրս մենք հայտնաբերել ենք 61 կանանց, ովքեր հղի են և դրական են փորձարկվել COVID-19-ի համար։ Այս կանանց 10 առ 100-ը գտնվում է առաջին երամսյակում, 33-ը երկրորդ երամսյակում, իսկ 34-ը երրորդ երամսյակում։ COVID-19 ունեցող 12-ին արդեն ունեցել է կենդանի ծնունդ։ Այն 6 նորածինների համար, որոնց մասին մենք տեղեկություններ ունենք, բոլորը բացասական էին։ Առողջապահության աշխատողի դարմացում։ Մենք հայտնում ենք լրացուցիչ 654 հաստատված առողջապահական աշխատողների մասին, որոնք դրական են փորձագել COVID-19-ի համար, ընդհանուր թիվը հասցնելով 1441-ի։ Այս դեպքերը ծագում են Լոս Անջելեսի շրջանի 26 տարբեր բարամետրերից։ Առողջապահության աշխատողների կեսը հայտնի էր COVID-19-ի ազդեցության տակ, իսկ 36%-ը ենթարկվել է մեկ այլ բուժաշխատողի կամ հիվանդի կողմէ։ Մենք ցավով հայտնում ենք 5 բուժաշխատողների մահվան մասին եւ բոլորն էլ վերջերս են եղել։ 3-ը աշխատել է հմուտ բուժքույրական հաստատություններում, մեկը աշխատել է ուղիչ առողջության մեջ եւ մեկը աշխատել է հիվանդանոցում։ 5-ից 3-ը բուժքույրեր էին։ Եվ առողջապահության աշխատողների ընտանիքներին մենք շատ ցավում ենք ձեր կորստի համար։ Այս աշխատողները համարձակորեն օգնում են հիվանդ մարդկանց եւ նրանք հերոս են։ Չենք կարող բավականաչափ շնորհակալություն հայտնել ձեր զոհության համար։ Շարունակենք հետևել դանը ավելի անվտանգ ուղեցույցների։ COVID-19-ը տարածվել է մեր համայնքում եւ մենք պետք է շարունակենք անել հնարավորը այդ տարածումը տանտաղեցնելու եւ հնարավորինս շատ վարակների կանխարգելման համար։ Շարունակեք հնարավորինս տանը մնալ։ Եթե դուք պետք է դուրս գաք հիմնական ծառայություններից, ապա հագեք մաքուր գդորե երեսի ծածկոց եւ պահպանեք բոլոր այն մարդկանից 6 ոտնաչափ կամ ավելի ֆիզիկական հեռավորություն։ Դեմքի ծածկոցները պետք է հագվեք, երբ դուք մուտք եք գործում հիմնական ծառայություններ եւ գտնվում եք այն անձերի մոտ, որը ձեր ընտանիքից չեն։ Սա նշանակում է հագնել այն, երբ գնում եք սննդի գնումներ կատարելու կամ տեղամտուն մտնելու։ Դա նաև նշանակում է հագնել այն ժամանակ, երբ երեխային դուրս եք ձգում կամ երեխային խնամում եք եւ երբ ռեստորանից սնունդ եք վերցնում։ Գցեք կտորե ծածկոց երեսի, երբ օգտագործում եք հասարակական ավտոբուսը, փրկարար ծառայությունը կամ տաքսիները։ Եթե մոտենում եք ձեր տնից ոչ մեկին, ապա հագեք մաքուր կտորե դեմքի ծածկոց։ Սա կօգնի ձեզ վիրուսը չի տարածել ուրիշներին եւ պաշտպանել մեր հիմնական աշխատողները։ Ապաքինվելուց հետո հարկավոր է տանը մնալ առնվազն 3 օր, 72 ժամ, ինչը նշանակում է, որ ձեր ջերմությունը իջել է առանց ջերմիջեցնող դեղի օգտագործման եւ ձեր շնչառական ախտանիշներում, որն է հազը շնչավորության դժվարացումը, բարելավում կա եւ առնվազն 7 օր անցել է ձեր առաջին ախտանիշները ի հայտ գալու օրից։ Եվ շատ կարևոր է, որ դուք պետք է տեղեկացնեք բոլորին, ում հետ մոդիկից շփվել եք, որ նրանք վարակվել են եւ պետք է կարանտինում լինեն 14 օր։ Ասեք բոլոր նրանց, ում հետ մոդիկից շփում եք ունեցել 48 ժամ առաջ ձեզ մոտ ախտանշանները հայտնվելու բահից։ Մենք ամեն օր ոգեգոճված ենք բոլորիդ կողմից, ովքեր շարունակում են անել ձեր մասը COVID-19-ի տարածումը տանտաղեցնելու համար։ Այս դժվարին ժամանակներում շատ մարդիկ ցուցաբերեցին քաջություն, բարի կամք եւ կարեկցանք, քանի որ մեր կյանքը կտրուկ փոխվել է, եւ մենք բոլորս տարբեր կերպերով ենք աստվել։ Այս ժամանակները ծանր են, բայց դրանք ժամանակավոր են։ Մենք միասին ենք դրանում եւ միասին աշխատելով մենք հնարավորություն ենք տալիս հասնել դրան մյուս կողմը։ Շնորհակալ եմ բոլորիդ. And this concludes our press conference for today. Thank you.